I will explain what health protocol must be done in the current COVID-19 pandemic. Okay, just go ahead. Headlines about the coronavirus seem to change every day, but there are things that we do know, information about what it is and how you can protect yourself. Coronavirus looks like this under a microscope. There's a whole family of them, and they cause things like the common cold and other lungs infection. The strain of coronavirus that's making news cause the COVID-19 infection. Researchers think it first passed from an animal to a person, but no, it's spreading from person to person, and part of the worry is how it spreads easily compared to other viruses. It can cause mild to severe flu-like symptoms we hear a lot. About the numbers of people with coronavirus, and it's important to know that most people diagnosed with COVID-19 are recovering, but in some people it can cause a much more serious illness. According to the Center for Disease Control and Prevention, the CDC, people who have the highest risk of getting really sick seem to be the elderly and people of all ages who have underlying medical conditions like asthma, diabetes, heart disease, or obesity. Hospitals are also caring for patients younger than 65 years of age who do not have prior health problems but are still getting sick with COVID-19. So the best way to protect yourself is to lower your chance of exposure. The main way the virus spreads is when people cough, sneeze, or talk. It can also remain in the air for several hours. These droplets can be breathed in by a nearby person on land on a nearby surface. An infected person also may touch his or her mouth or nose and then touch something else like an elevator button or shopping cart. The virus can live on surface for a couple of hours to several days depending on the type of surface. Healthy people come along, touch things, touch their face, and then they can get infected. The good news is that you can do things to protect yourself. The CDC has many tips that can help prevent the spread of the coronavirus, and it also has a full list of underlying conditions for those at greatest risk. Do wash your hands later up with soap and warm water and rub for 20 seconds. About the time to text to sing happy birthday twice, watch the front and back between your fingers and under your nails. Do wash often before, during, and after preparing food, before eating, after using the bathroom, after blowing your nose, choking or sneezing, and after you touch things lots of other people come in contact with. Remember that elevator button and that shopping cart. To use hand sanitizer if you cannot get to a sink with soap and hot water. Make sure the sanitizer is at least 60% alcohol and rub it all over your hands and fingernails for 20 seconds. Let it dry completely to keep a safe distance from the people who are not in your household. Staying 6 feet away from somebody is usually far enough to keep you from breathing germs. Do use cleanser or soap and water on things that get touched a lot in your home. Items like electronic, doorknobs like switches and railings. Check the EPA website for a list of approved cleaners. You can carry wipes to clean surfaces in public area, door handles, things shared in the office, and anything else loose of people touch you. Wear a cloth mask when going in public. Use it for people over the age of 2 and check the CDC website for guidelines on how to make and safely use a mask. Don't use a surgical mask because these are in short supply and healthcare workers need this, and don't put a mask on someone who is asleep or unconscious or anyone who can remove the mask themselves. If they have trouble breathing, don't touch your face, especially mouth and nose. Don't call for sneeze into your bare hands. Instead, touch or sneeze into your elbow or into a clean tissue that you throw out right away. Don't share food, drinks, and towels. It's an easy way to share germs. Coronavirus might feel like a big, scary unknown, but by following this advice you can cut down your risk of getting sick. That's the explanation from me. Thanks for your attention.